First of all, I'm able to confirm that as of 9 o'clock this morning, there have been 1,993 positive cases of COVID-19 confirmed in Scotland. That is an increase of 430 since yesterday's figures. It is, however, important for me to point out that 108 of those 430 come from one laboratory which was unable to submit data over the weekend. That's part of the reason why the increase that I've just confirmed today is so significant. The increase also, of course, reflects the ongoing expansion of our testing capacity, which I have talked about previously. As of last night, I'm also able to confirm that a total of 135 people were in intensive care with either confirmed or suspected cases of COVID-19. That is an increase of 27 on the figure I reported yesterday. And in total, including those who are in intensive care, there were, as of last night, 1,073 suspected or confirmed cases in hospitals across Scotland. And lastly, it is with sadness that I have to report today a further 13 deaths of patients who had tested positive for COVID-19. That takes the total number of deaths in Scotland now to 60. At present, just over 6% of NHS staff are off work, either with COVID-related symptoms or self-isolating because somebody in their household has these symptoms. That number is relatively low, and it's important to be very clear that we would expect to see that number rise in the weeks to come. But it's also important to note that we have now begun testing of key workers, and as we continue to expand that capacity, we will be able to get people back to work as quickly as possible. And today we are confirming that more than £1.5 million will be given to Scottish Women's Aid and Rape Crisis Scotland. There is, as I think everybody understands, a real risk that women and children who are already subject to domestic abuse will feel even more isolated and vulnerable during this crisis. So this funding will help to ensure that they have access to support